Hello, you're listening to the Eric McKenna Project.
So, Doctor, can you explain a little bit or the definition of an integrative oncology?
Yeah. So I'm glad you asked because I always like to start out any talk I do, any conversation that's formal with definitions because
We're not formal.
Not formal, but you know where my words and voice are going out into the world.
Absolutely.
By defining it.
Absolutely.
Because I think it's important not just for what I do, but what I don't do, so that people understand.
Okay.
So I'm gonna back up. So I'm gonna start by defining alternative medicine. Okay. Because that's a word we hear all the time and maybe don't really necessarily know what it means. But I define alternative as a non-traditional mode of healing instead of conventional medicine. So someone might be diagnosed with cancer and say, I'm not going to do chemotherapy, radiation, surgery. Instead, I'm going to do something alternative. For example, a complete juice fast or IV electrolytes. I'm going to go to an alternative practitioner, and instead of conventional medicine, I'm going to choose alternative.
Okay.
So then the next level is complementary.
Okay.
So complementary medicine is a term that became more used in maybe the 80s, and that was meant to say in this world of people trying more non-traditional modalities, more of a wellness focus, wanting to do less rather than more. Complementary is some of these non-traditional modes of healing side by side. So, for example, someone might be diagnosed with cancer, go to their cancer doctor, take chemotherapy, but on the side, go to a chiropractor, go to a naturopath, use some of these modalities, not have the two sides speak, not even necessarily tell the two sides about each other, but have those things happening in parallel.
Okay.
So integrative is a term that arose that I've really tried, and others have tried to kind of nuance to make the definition more clear. But it basically means taking these non-traditional modes and really weaving them in to conventional medicine so that you really have a thoughtful, transparent care team that is both non-traditional and conventional. And so what we've tried to create at UPMC at Hillman with integrative oncology, and you could put integrative in front of integrative medicine, integrative cardiology, integrative, but for us it's cancer, is we're taking non-traditional modes of healing and weaving them into conventional medicine with the guidance of a medical oncologist, but with the respect and healing help of non-traditional practitioners. So that's a big definition, but I think it's important to make sure that you kind of get the background.
Absolutely. Yeah, and this has to be newer, right? Because we've always, as consumers, I think, have been, there's always two paths. And I think the logical path to most logical thinking people is you absolutely go the medical route.
Yeah.
And maybe the other alternatives are just, they're there, but how do I say this? I think most people would not go the alternative route in light of medicine. So I want to make sure that
I think you'd be surprised.
Really?
And I also think that things are changing in a lot of interesting ways where there's sort of more of a background commitment to wellness, to eating well, to not wanting to put products around us or breathe products or drink products that might be toxic. So there's kind of all that going on in the background. And then I think there's also, I think as a part of that, a desire from a lot of people to just take less medicines. And that's what I see a lot is, people that accept that they need conventional medicine, but they're still asking a lot of questions about the why. So you were saying this must be a new thing. I mean, I think there's been a demand for it, but maybe the way we've really studied the problem and had the wherewithal to understand it in a conventional setting, that's new. You have people creating these practices that are integrative on the sidelines. They don't take insurance. Their real doctor's not going to talk to you. You're kind of just on your own, and they don't really fit for people that are really sick. that need hospitals, that need doctors, that need CT scans.
That was where I was kind of going.
So I think it is new in that sense.
Okay, but the integration is also ultimately new, where you have your traditional scientific medicine.
Yeah.
but the doors are open to bringing these other forms of treatment together. Is that right?
I think yes.
Okay.
I would say yes, definitely.
Okay. Now, when did this start? When did this idea come?
Yeah. So, again, backing up, when I was in medical school and doing my training after medical school, I knew that I wanted to be the kind of doctor that knew a lot of stuff, that didn't know one thing about one. I didn't want to just focus on one organ or one body part. And so when I was deciding my specialty, I really liked oncology for that reason, because any tissue in the body can get cancer. Right. Any system can get cancer. And so to me, it created this expert in the whole body. And also, it was really serious. I really didn't want to like fuck around and be talking to people that hurt their thumb. I wanted to be a doctor that dealt with, if I was going to make these sacrifices in my life for my family, be a doctor, I wanted to be in it.
Absolutely.
So it just fit that I wanted to be in oncology. So then when I got into oncology, I realized even further, like I was really interested in the big picture, people's whole lives. I wasn't just interested in what interaction I was having when we sat at the exam table. I was interested in what they were eating, what their life was like, what their stressors were like, how they got to this appointment. Did they take the bus? Did they take a car? Did their brother drive them? I thought that was really important, but I didn't necessarily have all of the time available to explore all that while I was doing all of the oncology stuff. So I would sort of print out something from the internet on a yoga studio or a yoga breath or something about food that I thought might help that they were thinking about, some simple breath work. And that kind of evolved in that first 5 years that I was in practice, me realizing it was important to me realizing maybe I didn't have as much time as I wanted to devote to that, but realizing that I was going to kind of just try and it was going to be part of my practice. Sure. In the meantime, I care about that stuff. I care about health. I care about mindfulness. I think exercise is important. Eating well, I think, fuels my body. I care about my social interactions. I care about energy in, energy out. It's just part of what I've always felt and cared about. So it made sense to me. And I was starting to kind of incorporate it into my practice. And then my mom got sick. And I was about 5 years into being an oncologist. I had 3 boys at home, one who was an infant. And my mom, who'd had kind of a very low level cancer that she should have lived with for years. Suddenly her cancer changed and it became very aggressive. And my mom was a very matter-of-fact person. She was very independent. She didn't really ask for help. And I saw her struggling in ways that, you know, I never had seen her struggle before. And that really, in my world as a kind of like oncologist seeing patients and then being a real person with a mom who had 23 hours a day of not knowing how to deal with this difficult, it's kind of existential, but this was this major thing that happened to me. And not to me, this happened to her and our whole family. And so being in the throes of it in that way, seeing her sick, seeing her suffer, changed my whole mentality. And seeing how much my family struggled, and we were supportive, tight, well-educated. My dad's a doctor. We were like, we knew what the hell was going on. It was like we fell apart. And then when she eventually got so sick and she passed away, and in and around her death, I was able to like help her and help my family, and she had a really good death, which is getting kind of very deep very fast. But I guess my point is, it just really hit home how much this all matters on this continuum of like, not just when people get sick, not just if they're cured, not just if they're suffering from symptoms, but helping people understand some ways to control this life of ours and control this death of ours and be on the front end of all of this. So it was this major, crazy, overwhelming, difficult, but very powerful moment where my mom passed away. Our family really bonded together. She had an excellent death at home with all of us there for her. And it was like this, I call it like my battery pack, because I was like, this is what I need to do.
Okay.
I need to put together a way, because I'm in this position where I know the medicine and I see what people need, what I think people need,
right.
and I can put this together.
Okay.
So that's when things just exploded. And I started to kind of slowly kind of chip away at this strategy to take the Hillman Cancer Center, the mecca of rigorous conventional oncology, and say, how can we bring mind, body, spirit into this? Because I can do it.
Right.
And I know what people need, not just because I hear it, but because I've been there.
Lived it.
And that's sort of how it all started.
Yeah. So, okay, there's a lot there.
Yeah.
No, but it's good. So, Hillman being the mecca, right?
Yeah.
Of conventional medicine. How was it initially? How was it initially received? The idea, just the basic idea when you started to formulate what you wanted to do.
So, I mean, I've been so I tend to be an optimist, so I see the good things first, and so I will say that for the most part, I had so much support from like my administration.
Right.
My boss is Dr. Stan Marks. He's a mentor and a great friend of mine, and he was always supportive of what I wanted to do and believed in me.
Very well known.
Yes. And that helped a lot because he was extremely supportive.
Sure.
But I think also people understood, if you're in the business of taking care of patients with cancer, you understand that people are suffering. You have a heart that is made of something and you want this. It's just you don't always have the time. So I think people understood that it was needed, but also had seen a lot of things not work. And so what I was looking around at was kind of people or programs that had kind of faltered trying to bring this concept, but kind of weren't in the middle moving outward. They were not medical doctors, or they were medical doctors but not oncologists, or they weren't inherently connected to the medical record or to the physicians. They couldn't comfortably call up a physician and say, this is your patient, she's really struggling. There was no integration. Exactly. So the first push was kind of the struggle of trying to say respectfully and diplomatically to these other things that had kind of not succeeded.
Okay.
Great, but like, this is different.
Okay.
And not offend or make difficult relationships with those people that were out there trying and not succeeding.
Okay.
So that was the first layer.
Okay.
And of difficulty. And the second layer, I think, is just a very typical notion for people that are trying to do something different. Like, we haven't done like this before. We don't have an algorithm for this.
Right.
There's no template for this. How can we contract a provider who's not credentialed in the shmashma and the shmashma and the wawa?
Change.
So that is like the overarching, you know, and in a place like UPMC, that is an institution that has succeeded because of all of these rules and regulations and algorithms, you know, kind of trying to maneuver and massage that. How many phone calls does it take to get a meeting? How many meetings does it take to get a memo? How many memos does it take to make change? So that, I think, in the sort of big story is the constant change. And that's what will make me like want to poke my eyeballs out at night sometimes, you know, or just like curse or vent or do whatever, or like, you know, run for a couple hours, whatever it is.
I can imagine.
But at the end of the day, I get that. And I'm in a position to figure that out. And that, I think, is in part why it's worked.
You feel pioneering?
I do, only because I think we're like seeing, you know, maybe bird's eye view or however you want to describe it. We're seeing this path and we're like, oh, we're going to go this way, we're going to that way, we're going to do this, and then we're going to build this. And so it is pioneering because no one's thought about it the way we have. Nothing is rocket science. Nothing is groundbreaking. The pieces are there, but we're just figuring out
the integration,
the way to do it.
Yeah.
So I do.
Okay.
Yeah.
Can you give me like a time frame, like what year?
Yeah.
Would you get the? Was there a formal approval, or was it on a trial basis? How did it go?
It was a slow and incremental approach. So in 2013, we decided to we got a small grant from within the hospital to have what we called our first integrative cancer wellness fair. And so this was an opportunity to get medical people, nurses, doctors, patients in the same room with integrative providers, yoga therapists, massage therapists, acupuncturists, aromatherapists, nutrition people. And, based on my own experience and tapping into people and kind of 6 degrees of separation that is Pittsburgh, we gathered together this amazing group and had a little bit of money to make it really nice and have nice food and give people a gift bag.
Food helps.
And food always helps. And organize it really well so that people walked into that room, and this was at Shadyside Hospital, so it felt safe to patients, safe to staff.
Sure.
And we were also very, I think this is kind of an important point, like we've always been very, not strict. I don't know what the right word is, but we've been very clear with our messaging to our integrative providers. We've said, if we're going to integrate, you guys also need to be professional. You need to look the part. You need to talk the part. You need to not say goofy things that are going to upset people. You're not going to say you're curing the cancer or treating the cancer. So we created very early on this code of ethics for all of our integrative providers, where we kind of explained, and it was based on transparency, but this is an integrative approach in a rigorous conventional medical setting. You are here to help manage symptoms and help with quality of life. You are always doing everything with me as your supervising care planner, and that helped us get the right people. So we got people that knew how to respond to emails, knew how to show up on time, knew how to be professional in the way they spoke to patients. So that was super, super important.
I bet.
Because I think the world of non-traditional healing creates really special people and people with a special type of skill, but not necessarily does that always coincide with being professional. And in the medical world, especially at the Hillman Cancer Center, you need these people to be professional. So that was also something that we really worked hard on.
So you're looking at the creme de la creme then.
Absolutely, in a really vetted process.
Right.
So this fair was basically like, let's just like throw all this stuff in a room and see what sticks. And it was amazing. It was like over 250 people came.
Wow.
We had like just this amazing energy in the room. You had patients talking to these providers. We had all these people set up to like, do massage right there, do acupuncture, explain these things to people. And it was like, boom. So that was like this day that was like, oh yeah, there's something here. So that fair, and that was in 2013, that like set the whole thing off on fire. So after that happened, we began to create our vetted provider community. And I started to kind of softly see patients in my practice, which was medical oncology, where I was seeing cancer patients. I started to see them just for this, to say, okay, you have pain and you have anxiety and you can't sleep and you're nauseous, but the nausea medicine makes you constipated. Why don't you try this? Let's talk about your diet. Let's talk about exercise. Let's talk about massage. And then using these providers on the outside, just kind of started to connect them. So that process, and that was like, I got support. I was like, Dr. Marks, can I do this? He was like, sure, do it. So that grew and became really popular. And then we started to say, okay, what's next? So then we got another grant where we started to train some of the nurses, or think about a nursing curriculum.
The ambassador
The
program?
nurse ambassador program. So you have all of these amazing oncology nurses, and oncology nurses are like the heart and soul. They make everything happen. And they're also on the front lines. And they also just have this intuition, I think, on how to help people. So they were this like captive audience that wanted to be more a part of this. So we came up with the curriculum with these vetted providers that we'd been kind of cultivating to teach nurses in what is now a 2-day rigorous curriculum with continuing education and a whole iPad of resources and its own app. But what it started out was just us teaching nurses bedside skills. Here's how you use aromatherapy. Here's how you use hand-foot massage. Here's how you use breath techniques and lead someone in a guided meditation when they're feeling overwhelmed. So that was kind of started to cook in the corner. So then we set our sights on, how are we going to make this sustainable? We need money. And that's when we looked at Pittsburgh and all of the amazing foundations and opportunities to build something, and started to think more strategically. And we ended up getting a grant from the Mary Jennings Hillman Foundation to build our space. And so our space, and this was in like 2010, 2016, 17 when we were kind of planning and applying. And ultimately, we got a chunk of money to create the Wellness Suite, which is in the Hillman, right in the thick of everything.
Right.
And once we had a space, and the space it's about 800 square feet.
Okay.
It gives me a place to see patients. It gives our dietitian a place to see patients. It gives our acupuncturist, massage therapist, yoga therapist.
Wow.
And we keep that place running. We run 2 rooms, 4 days of the week. We do all the operations. We set people up for their appointments.
Right.
We are incorporated into the medical record.
Okay.
I mean, and that's been so that's what we've been kind of up to these last 4 years.
Understood.
Is bringing all of this operations into it.
Okay.
And at the end of the day, having that space, it's like if you build it, they will come.
Right.
And now we're just doing it all the time. So we have the consult service with our space.
Okay.
We have all these amazing providers. We have them teaching nurses. We have the nurse ambassadors. We now train almost 80 nurses. They're at St. Margaret's, East, Passivant, Hillman, Pinnacle. They're in the inpatient
So the training
units.
center included in there.
The training center. So we do the training at the Hillman.
Right.
And then we sort of launch these nurses out into their environments.
Right.
We try to give them as much support administratively, because you can't, that's the thing about a huge institution. You can't just be like, this is great, I want to do it. It's like, okay, but who's the chief nursing officer at Pinnacle, and who is your unit director on 6 Main, the oncology unit? How can we make sure you have time to see your 7 patients, give them their meds, but also have an hour to round and do hand-foot massage? It's operations, and it's not all touchy-feely to get to the touchy-feely.
I can imagine trying to see. To me, it would appear that there would be trouble initially trying to get those other institutions to buy in.
Yeah.
Especially if you're doing the training on their folks. You send them in.
Yep.
And then you have to get them to the administration to buy into it.
Right. But but it's been pretty. I mean, I think what we did was we created everything kind of small at the Hillman.
Okay.
And then the word got out about how great it was. So we actually more had people coming to us.
That's positive. That's positive.
Because, it's win-win. It's patient experience. It's nurse empowerment. It's the right thing to do. There's a consumer demand. I mean, it checks all the boxes. And we're saying, we've already done it. You just send your nurses. It's all done.
Okay.
So our product was really good.
Okay. Talk a little bit about acupuncture.
Yeah.
What's your thoughts on acupuncture?
Yes. So acupuncture is an ancient practice. It originated as ancient Chinese medicine. It uses tiny needles to access different, we believe, nerve channels. And we don't totally understand how it works. The needles go in various places on the body, on a map of the body that's sometimes called a meridian, and different acupuncture spots correlate with different symptoms.
Okay.
And then there's various different families and schools of acupuncture. You can use the tiny needles with or without electricity. There's a lot of variations on it.
Okay.
But the basic concept is the needles stimulate something, send messages to the brain, release hormones, and create modulation of symptoms, whether that's pain, nausea, sleep. In our practice, we use regular acupuncture, no electricity. The needles are placed in different areas based on our expert acupuncturist. They're placed very superficially, almost like with a flick of the wrist, because a lot of people ask, is it painful? The needles are thin. We describe them almost like a cat's whisker. And the acupuncture process is different for everyone, but for many people, they will experience a cumulative improvement in their symptoms.
Okay.
And some people feel a difference right away. Other people, it takes several sessions. We see a lot of patients looking to be on less medications. And then we see a lot of people that have heard of acupuncture and want to try it.
Sure.
But it's our most popular modality, and we see a huge amount of improvement in pain, in nerve pain, in nausea, and in hot flashes. I would say that's the most common symptom clusters that we see relief for.
Okay. Are you a big proponent of yoga?
So yoga, I'm a big proponent of yoga. I've done yoga all my life, and I believe in the power of movement and breath. I also think it can be hard to get into yoga if you don't have a teacher that speaks to you, or kind of slow and steady movement is maybe not for you. But I think the thing about yoga is that it exists on this spectrum where yoga is at its one extreme, basically just breath, moving breath into the body and correlating that to some kind of movement, which breath is movement in itself. Right. And then on the other end of the spectrum is this very vigorous practice that you can do for fitness, for exercise, for strength. And somewhere in between, I think there's ways to customize it to everyone at any level of health or sickness. Because what we see is a lot of people that either have pain or have limitations or are coming out of a surgery or are tired from their chemo. They want to move carefully. And so our yoga program is based on our leader in our yoga practice. Her name is Sadie Grossman. She has an actual master's in yoga therapy, which is pretty unique, but she understands the anatomy and she understands all the different aspects of the yoga practice. So she can look at someone and say, we're going to just start with breath work, or, I think you need to move in order to be still. And then she can also look at people that have had mastectomies from breast cancer, colectomies from colon cancer, and understand the best and safest ways for them to use yoga and movement and breath work. So our yoga program starts out with one-on-one yoga. And then we are expanding to do more group classes that are more thematic so that people feel comfortable. Another awesome thing about our yoga program is staff yoga, so like self-care. People that are working in cancer as practitioners, it's kind of intense. You're dealing with people that are sick, people that are stressed. You feel things. You don't want to feel things. You worry about yourself. So Sadie teaches 2 morning classes just to staff where we can start our day with breath and movement. And that's also super interesting and important, is how can we bring that culture into our medical culture? So
that has to be new.
I think it's new to be that deliberate about it. You know what I mean? To be like, we're going to offer this class, but we're like, this is why we're doing it, and it matters, and we're going to say it with intention every day that this is why we're doing it and that matters. So I think that's new.
We may have a mutual friend. Jennifer Ferris-Glick.
Totally, absolutely. And Jennifer
was on my show. Were you aware of that?
She was involved from the beginning. I saw when I looked at your list. Totally. And this is her philosophy as well. This kind of
she opened my eyes quite a bit. It was excellent conversation.
Yep. Yeah.
Excellent conversation.
She's a good one.
What about massage?
So massage, I think, the power of touch is enormous. And a lot of people, when they have cancer and when they're getting treatment, they feel really isolated. They feel toxic. They feel like they shouldn't be touched. They feel like cancer is their fault. I'm just throwing out some of the things that I think might be happening to them. So I think in that setting, even more than regular life, touch is super important, to feel like you're human, that someone cares, that someone wants to touch you, someone will touch you, and that human touch makes you feel so much better. So I think at the heart of that, massage is a wonderful modality for people with cancer. Our massage therapist is oncology massage trained, which means she has additional training. She understands ports, which are IV catheters that go in for chemotherapy and blood work. She understands a catheter that someone might have after a bladder surgery. She knows what to stay away from, but also she knows what she doesn't have to stay away from. And so our massage program is, again, really customized, really supervised, really safe, so that she can deal with people that are sick, but also let them have a full body massage and feel really excellent from that. Massage helps a lot with, I think, relaxation at its core. It can help with pain, of course. It doesn't seem to have the kind of cumulative effect that acupuncture has for pain management or symptom management, but it can really help with kind of the mental relaxation and feeling like I need a way to let my body relax so my mind can relax. And people that use the massage program with us might use it regularly. They might get a massage before a scan that's making them anxious. They might do it to kind of celebrate the end of a chemo cycle. So I think there's just a lot of really practical, ritualistic ways to use massage. And we're really down with trying to brainstorm with people about that.
I know this is going to open up a good one for you, because I know you want to talk about this, and that's going to be nutrition.
So, I mean, I think it's just so clear that it matters what you eat. And that's not at all to be judgmental, because I think eating should not, like I say this to my patients a lot, like food should not be a battleground. And there's so many instances in sickness or cancer when food becomes something that becomes a battle.
Okay.
You need to eat. You haven't eaten. People want food is love, food is care, food is nurture. And then on the flip side, there's so much out there in the press that foods cause cancer, everything causes cancer, coffee causes cancer, coffee doesn't cause cancer, wine causes cancer. So you just have people coming at you with a really, really stressed, rigid, fearful, catastrophic viewpoint. So the first thing I try to do with nutrition is like break that shit down. Like this does not have to be a battle.
How do you walk that back though? Because everybody's confused.
Everyone is confused.
Me too.
Everyone is confused. So I guess I start by just hearing out what people are confused about.
Okay.
And kind of reassuring them that they have a reason to be confused. That like the way that stories are put out there and research is done on nutrition is confusing. Then I try to go back to just sort of core, common sense, overlapping practical good nutrition practices. So there's a lot of different ways to eat well. A lot of it depends on what fuels your body, how active you are. But the basics are kind of real food, things that aren't packaged or funky colors, something that can't stay in your closet for 5 years, as much from the refrigerator, as much real fruits, vegetables, whole grains. You like meat? Get good meat products. Get grass-fed beef.
Absolutely.
Get organic chicken, milk, eggs. Think about all of this, but don't get crazy about it because it's just kind of eating real food.
Yeah, we're really obsessive in this country about
We can be really
food.
obsessive, and part of that's marketing. Part of that is trying to get people to buy their products.
I think fear is
a lot of it is fear. And then I think I just don't want people to think that they made their cancer come or they're gonna make their cancer come back. So I try to do a lot around it's complex. There's multiple signals that lead to cancer or lead to cure, and eating is meant to be something that fuels your whole body.
Sure.
So those are some of the discussion points and principles I put out there.
Okay.
But I also I also try to be real about it. There's a lot of doctors that will say it doesn't matter what you eat or just get calories in, even if you're going to McDonald's. And I think we all know at this point that that's not true. And it's not helpful to just say that because you don't have a better answer than that.
Correct.
So should you not be obese? Yeah. Does that suck to hear sometimes? Yeah.
Absolutely.
Are there some ways to kind of give you tips and ways and accountability and help to get there so you don't feel alone and you don't feel like like fat loser? Yeah. So there's just a lot that we can do.
Society's very harsh on body image.
Very
all of that.
much. And people that are sick, the last thing they want to do is feel additionally stressed about that.
Right.
So I think it's just important to make people feel like they have a place to come to talk about it and not feel shamed. I think the cornerstone of what we're trying to put out there is being non-judgmental and just starting there.
You said you had a father that's a surgeon. Is that correct?
He's a neurologist.
Neurologist.
Yes.
Okay.
Yes.
So what led you to medicine? Was it just parental influence?
Yeah.
What you grew up with?
I think that was part of it. So I was the middle of 3 daughters. And I always was pretty good at school.
Okay.
And I was pretty good at science and math. And then my dad was a doctor who was really happy and satisfied with his life and his career. And it just sort of I didn't ever think or struggle with the decision. It was just like, this is what I'm going to do. And so I just kind of moved forward in that space, doing the things I needed to do.
Okay.
And it always made sense.
You just knew.
I just knew.
You just knew.
I just knew.
Okay.
Yeah.
I was always curious about what that one moment, if there's ever a moment that you just decide, this is what I'm going to do.
I think I was just always on that track,
Always on that path. Okay. Obviously, I wouldn't ask you to give a full dissertation, but can we talk about just some simplistic things here I think that most people, including myself at times, are confused on?
Yep.
What is cancer?
Yeah. I love taking it back. Forest through the trees.
That's what we do here. Let's take it back.
Yeah. So, cancer is really defined as unrestricted. It's a horrible word. It is. It's unrestricted cell growth.
Okay.
So it's cells that have lost the regular breaks. So normally cells mature. They kind of go through certain designated processes to mature and then die.
Okay.
And then new cells come back and do the same thing. So cancer occurs when those normal processes are no longer in place and cells just continue to be produced and not die.
Okay.
And then there's all these different nuances and levels of that. There's really slow growing processes like that. There's really fast growing processes like that. But that's really it. And it can happen in the blood. It can happen in any tissue or organ of the body. And that's where kind of the differences in how cancer presents itself and how it's treated come into play. How fast that unrestricted growth is, and then where in the body that is, and what that tissue environment means for how the cancer does or does not spread.
So correct me if I'm wrong, but science does understand there's certain things that will cause cancer.
Yes.
In science, we know that radiation, or we know that, we can identify that, but we have a lot of other cancer appears for other reasons that we don't have our arms around yet. Is that correct?
Yes. And that is tricky because, some of the things that cause cancer, carcinogenic materials that are out in the world, radioactive substances, Agent Orange, we know that they cause cancer, but we don't necessarily know at which point in this kind of cell development it's happening. Is it at the early level at the stem cell? Is it at the protein level at the signaling pathway? Is it the very end of a pathway or the beginning? Is it shutting off one of the kind of protein structures within the enzyme that turns off the cell? So it's when you get into that you just don't know, and you don't know how these things interact together.
Okay.
So when you take something huge like food or stress even, that is kind of just so diffuse and everywhere and really hard to quantify, and then you try to layer that on top of the process of cancer, it's really hard to say what, where, how, and why, even though we might know so definitively that it does, or we might have these really long historical longitudinal studies that looked at hundreds of thousands of people with cancer and what they ate or how they managed stress in their lives, and we see that the outcomes are better for certain things. But it's not necessarily enough to say to you, Eric, as a man with X, Y, and Z who eats this way and works out this way and drinks this much water and has these genes, how that's going to play out for you.
Okay, because everybody's profile is different.
Everyone's profile is different, and then how everyone processes everything is different.
Okay. Once in a while you'll read, or they call it clickbait, I guess. You'll be at a news website and it'll say that there was a test and some cancer is now cured, or just It's not that simple though. Am I right to assume that there can't be a single cure for cancer? They may find a certain stage or a certain type of cancer. They may have something that pushes it back as we move forward, but there's not going to be a single solitary pill that will eradicate all kind of cancer. You don't anticipate that, correct?
No, I don't.
Okay.
But I think there are major success stories and principles that are allowing us to move forward with a lot of confidence that we're moving the needle. I think there's always going to be fast-growing, crazy cancers that we cannot treat or cure. And a lot of times a cancer will be treated multiple times and get smarter and get crazier. So a lot of times that's the end point of a cancer that was treated successfully for 4, 6, 8 years, is that it just becomes so rapidly growing, so de-differentiated that we no longer have any tools to control it. There are a lot of new developments in targeting certain proteins that we really are successfully seeing put the brakes on a process and can, in many ways, cure almost all versions of that disease state, but there's still going to be some outliers that are crazy. So I think we're making all of this progress, knowing what to look for targets, making our treatments less toxic and more narrow so that we're not killing as many healthy cells in our quest to kill the bad cells. So I think we're making progress, but I think there is always going to be cancer in our society.
Okay, can we talk about the two, at least as far as I know, the two major treatments, which is radiation and chemotherapy, and then how they're different?
Definitely.
Because when you say chemo, I think people just assume that's a treatment, but we don't even know what it is.
Yeah, it's such a good question. So, I mean, in a broad way, radiation is typically more of a local therapy. So radiation is kind of like freezing the cancer cells,
like a targeted area
them.
That they can identify.
So there's very targeted radiation therapies, and then there's more kind of larger volume radiation therapies. But in general, when you're radiating an area, you're not getting at every cancer cell in the body. You're just getting at the cancer cells within the radiation field. So radiation is used a lot for, one area of disease that's painful, or to kind of consolidate a surgical cure by radiating that area. Chemo, and chemo in the strictest sense of the word, is medicine that kills rapidly dividing cells. And so in that sense, it's pretty non-targeted, and it kills good cells and bad cells. And that's the reason why the typical side effects of chemo, hair loss, mouth sores, nausea, because those good cells that line your gut or line your mouth or create hair follicles, they die with the cancer cells. So in the strict sense of the word, that's chemo. And usually we think of it as IV, going through an IV, but we actually have oral versions of chemo that does the same thing too.
Really?
And chemo goes to all the cells in your body, either because it goes through the IV and is absorbed through your bloodstream, or goes through your gut and it is then absorbed into the bloodstream. Now, there are now different types of kind of anti-cancer therapy that are systemic but are not chemo. And those are more targeted. They might be targeted to a certain protein or immune receptor. And this is where talk about targeted therapy, immunotherapy, and oftentimes those medications are added to what we call a chemotherapy backbone, because the chemo kills the cells and then the targeted one goes after the more resistant or specific ones. So there's a lot of combining these different agents now. But I think sometimes we use these words interchangeably, and
the public gets confused.
It does get confusing, but I like to think about systemic therapy and local therapy, and chemo, targeted therapy, immunotherapy, anything that's going through the bloodstream or orally and eventually into your bloodstream is systemic. And then radiation, or even like a cancer surgery where you take out a cancerous organ, that's more local.
So where do you see this project of yours going? Give me a 5-year vision of where you want to be, where you'd like to see it go.
So, I mean, I want to keep building it at the Hillman, because to me, this is like our lab, our incubator. We're trying all these things out.
Are you running out of space?
And we're running out of space, but we're trying very hard to get more space. So the first step is, if we get more space, then we can really blow this up. And the space that we want it in the Hillman, and we want space for a kitchen, like a test kitchen, a demo kitchen where we can do classes and we can do demonstrations, and we can help people bring good, non-judgmental nutrition advice into their lives. We also want a group exercise yoga space so that we can bring groups of 2, 3, 4, 5, 6. We can bring staff. We can bring caregivers. We can run a yoga for cancer caregivers class. We can bring it all into the center. And then we want a space for support. Not everyone needs a psychiatrist, but everyone needs some kind of support. Is that peer support? Is that group support? Is it community support? Can we bring a young cancer survivors group into the Hillman so they feel enveloped by the true cancer community?
Right.
And then we just need more rooms for acupuncture, for yoga, for meditation. We need more space for me and my clinicians to work. So if we get that, we're golden. And I think we're gonna. So that's me and my people at the Hillman next 2 to 3 years.
Understood.
The Nurse Ambassador program's growing. We're opening it up to nurses outside of UPMC, because in my mind, if someone wants to build this at their cancer center, and I want people to build this at their cancer center, the thing they need to start with is this infrastructure of nurse ambassadors. So that, I hope, over the next 5 years can become bigger. We can run it 2 or 3 times a year, and we can start to bring in people that are oncology nurses from all over.
So the nurse ambassadors are the conduit to basically spread the word of the program, correct?
I believe so. They spread the word of the program. They know the right language and definitions, and they're doing the bedside care. So those are the 2 goals that I'm looking for. I really think that with what we've done, we have the tools to show really any cancer program in the US or even in Europe how to build an integrative program that will be sustainable and that will be supported and will help patients and will be accepted by their community. So if people want to come to me and ask me to help them build it, I'm game. So that's where I'm at.
Okay.
Yeah.
And how can they reach you?
So how can they reach me? So the best way to find us is through our website at the Hillman. So it's hillmancancercenter.com /integrative oncology.
Okay.
We have all of our contact information, any frequently asked questions about our program, and how to find out more. We also are on Instagram at UPMC Cancer Wellness. That has all of our announcements. It's always introducing our team, the new programs we're doing. So that's a great start. There's a newsletter.
Instagram's big now.
Yeah, it is big, and it's just kind of direct, you know.
It is.
And then of course we have.
Facebook.
I'm not on. I don't. Instagram. Okay. I'm on LinkedIn personally and professionally.
Okay.
And then our website is great. Our Instagram for the program.
Okay.
Yeah. What else? Yeah, I think those are the main things.
I want to thank you for coming in.
Yeah, thank you. It was fun.
Was it?
Yeah,
was it
so
good?
fun. Oh my God, I love talking about this.
I want you to come back and see me.
Okay.
All right, fair enough?
Absolutely.
Thank you so much.
Thanks, Eric.
Thank you, doctor.
Yep.
Yeah, it's all right.
Yeah.
Well, what'd you think, producer? Was it okay?
Did it go okay?
Was it all right?
I never knew anything.
Did you think it's interesting for people?
I didn't know much of that either. That was excellent. You did great. You're so natural.
You did great. I loved your questions.
Natural.